version of Inside Out.
Instead of emotions, we're all going to be playing different perspectives on opiates.
Take 5.
Hey, I'm Steve. A couple of months ago, I had knee surgery and was given painkillers to ease the pain. When I didn't have the pills, I was in unbearable pain. It got so bad that the painkillers stopped being effective, so I switched over to heroin. The heroin made me feel better than I've ever felt before, and I can't live without it. I know it's hurting me, but I can't stop taking it. And I know it's affecting the people around me, but I knew they would forgive me if they knew my pain.
Steve should not be taking this drug. It's killing him. Oh my gosh, what are you doing?
It's not killing him, it just feels good.
Oh, I don't know what to do. Okay. The question is whether Steve should be taking opiates or not.
I'm against the drug.
I'm for the drug. You should be taking it.
I don't know what to do. I don't know who to side with. What should we do?
Heroin is probably the most addictive drug in the entire world. It's pretty much just a synthetic, cheaper version of morphine. And how it enters the body is through injection. By injection, it enters into the bloodstream immediately and can go to the brain. Once they enter the bloodstream, they attach to opioid receptors in the central nervous system, and it triggers a massive rush of dopamine, which is the body's chemical is responsible for feelings of pleasure.
Opioids act on many places in the brain, including the nervous system, the limbic system, the brain stem, and many other places where it triggers relaxation and pleasure.
What Steve doesn't realize is he might be fired from his job, get in trouble with the law, or be isolated from his friends and family. At first, his family was enabling him. Enabling means helping an addict avoid the negative consequences of his behavior. But after a while, they gave up. They didn't want to be near a person over-obsessed with drugs who could not control their own body. Addiction touches everything in every one of his life. His addiction is ruining his life.
When taken as prescribed, patients can often use opioids to manage pain safely and effectively. However, even a single large dose of an opioid can cause severe respiratory depression, slowing or stopping of breathing, which can be fatal. Taking opioids with alcohol can also increase this risk. So, is he addicted to opiates?
Well, there's no set time for how long it takes for the body to transfer from drug dependence to opiate addiction. But the longer and more you use opiates, the faster addiction will occur. Unfortunately, Steve is not the only one facing this problem. It has been a rising problem over the past several years. Eventually, the number of opiates required to relieve the pain no longer works because the body has built an immunity. The result is a person taking more and more of the medication to achieve the same pain relief or high. Some signs of opiate addiction are craving of the drug.
Effects are feelings of euphoria, pain relief, drowsiness, sedation, lethargy, respiratory depression, nausea, paranoia, abdominal distension and bloating, constipation, liver and brain damage, tolerance and
Unannounced mood swings.
You're laughing.
Finally, experiencing symptoms like nausea, shallow breathing.
Because he injected himself, Steve Dynamite increases the risk of heart problems, pulmonary embolisms, gangrene, and chronic infections such as viral hepatitis and HIV.
If you said yes to any of these questions, you are addicted.
Oh, hang on though. I mean, addictions can be reversed. It may be hard, but Steve Dynamite is strong. He's powerful. He'll get through it.
I think he needs treatment. With both dependence and addiction, withdrawal symptoms may occur if the drug is suddenly reduced or stopped. Symptoms may include restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, cold flashes with goosebumps, and involuntary leg movement.
Opioids look like chemicals in your brain and body that attach to tiny parts of the nerve cells called opioid receptors. Scientists have found 3 types of opioid receptors, which are mu, delta, and kappa.
The switch isn't working.
Wait, so is he dead?
He's only 17.
You killed him.
But, okay, why is this on me? I didn't
Come
know
on,
this would
it's
happen.
all your fault.
You pushed him to keep using this drug.
But, hang on though, I didn't know this would happen. This is just... Okay, look, I'm sorry, I didn't know. What should we do?
Not listen to you?
Wait, hang on, I hear something. Wait, what's going on? Why are we seeing all funny?
I think it's a new type of treatment. Doctors are using virtual reality to distract addicts and people in pain with these videos. They could also use drug detoxification with medical management to help them so that they don't hurt themselves. They could also go to therapies for gradual discontinuation of opioids, counseling, and opioid replacement therapy. They could use medications like narcotics and sedatives, or they could go to specialists for pain management. They could go to a psychiatrist and a primary care provider.
It used to be, when you got hurt, a doctor would say, take 2 of these and you'll feel better in the morning. But soon, rather than prescribing pills, doctors could be sending you home with virtual reality instead.
If you hurt yourself, the instinct is to rub it. And in essence, what you're doing is you're distracting your brain by putting in additional signals that are benign signals and overwhelming the brain's ability to feel the painful signal. Essentially, what VR is doing, it's kind of like massaging the brain and sending signals like a massive spotlight straight into your brain. It's so overwhelming that the mind is not capable of thinking about these other things, like the pain signals coming from the toe.
Doctors like Brennan Spiegel are testing VR across a wide range of medical applications. But the big one is pain, specifically chronic pain. With the nation in the throes of an opioid epidemic, finding non-addictive ways to help people manage chronic pain is an urgent public health need.
What we've shown is that we can reduce pain by almost 25% without any opioids, with tremendous results compared to control condition. So we did a study where we had 100 patients, and half of them got virtual reality for just 10 minutes, and the other half got to watch the really nice relaxation videos in 2 dimensions. And when we compared them head-to-head, the VR outperformed the relaxation video by a long shot. So what did you think?
It's pretty relaxing. Almost made me forget I was here, like, cause you're there.
Spiegel and Cedars-Sinai are working with Los Angeles company Applied VR to run the clinical trials. They've already shown that shooting balls at red teddy bears can have a big impact on acute pain. So now they're testing content meant to have longer-lasting effects. Content that facilitates mindfulness, meditation, and cognitive behavioral therapy. VR might be new, but these pain management techniques are well established. VR just helps immerse and engage people who might otherwise be turned off by them.
We see VR as a way to teach them breathing skills by putting them through a guided breathing exercise in VR.
Eventually he turns his life around and he now helps people who are addicted. Guys, I'm sorry I got you into this. I'm sorry I got us all into this.
It's okay. He turned his life around, so it's fine. But I think we can all agree that it was wrong for him to take opiates in the first place. And I think we can thank our friend for trying to keep us on the safe track.
All right, Steve. So it has been a week and a half since I saw you. How have things been going this last week?
It's been going pretty good.
Okay. How have you felt in terms of urges for, the heroin or the any of the opiate drugs?
For heroin, yeah, it's been pretty strong. I've been fighting it.
Okay. What have you been working on those coping strategies that we talked about?
Yeah, I've been using the virtual reality headset you gave me. It's been going pretty good.
Okay, good. Any technical difficulties with that? Are you figuring it out?
Nope, none. Yeah.
Okay. That's nice. Well, if you compare yourself now to what you were 6 months ago, it's like 2 different people. You've been making a lot of progress. I'm glad to hear that the last week and a half has been good. I'm just going to recommend that we just keep on going. Keep talking to your sponsor. Keep using the virtual headset. If you need anything, you can always call, and congratulations on being 5 months, 3 weeks, 12, or in 1 day, clean.
Thanks.
Good work. Good work.